Okay, there's two areas that of hair restoration surgery that really require specialized information and specialized knowledge on the part of the surgeon. Those two areas are hair loss in women, and which is a much more complex topic than hair loss in men, and the cutting edge information about tissue culturing hair follicle stem cells. I'd like to take a moment and talk about each of those topics. Let's talk briefly about hair loss in women, very briefly. It's a complex subject. In male pattern hair loss, 99.99% of the men have an inherited problem related to the male hormone dihydrotestosterone. They inherit a pattern of hair follicles that are sensitive to dihydrotestosterone, and that sensitivity causes the hair to slow down or stop growing over their lifetime. Some people bald very quickly, other men it takes 20 or 30 years to define their pattern of hair loss. You can make that diagnosis in the restaurant from across the room because 99.9% of men that have hair loss for that reason. Now, women are different, however. Women don't go, there is an inherited form of hair loss in women, but it only accounts for the hair loss in about 35% of the women that have hair loss. The other 70% of the women that have hair loss that is caused by some other disease process. Something else is going on that's causing their hair loss. So when we see women with hair loss, we have to be prepared to address the problem with a much, much more definitive medical workup. So what are the things that could cause hair loss in women, and how do we discriminate between those? Well, the most common, about 35% of the women we see, is an inherited hair loss. They get a diffuse thinning throughout their entire scalp in its extreme. It usually doesn't show up until they're about 48 or 49 years old. Do they notice it? They never go skin bald in any area. They usually retain their hairline. And this is not a dihydrotestosterone related process. It's not like male pattern baldness that is DHT related. We don't really know what causes female pattern hair loss. We just know that it runs in families, that it causes miniaturization, that it doesn't make the hair go completely away, that it just gets really thin. The woman can lose 60, 70, 80% of the hair, but you'll always have some hair left in the area. That's the most common form. What's the next most common form? Probably about 40% of the women that have thinning hair have diseases of the skin of the scalp, inflammatory processes that are taking place in and around the hair follicles that cause the hair follicles not to grow. Some of those skin diseases are permanent loss, and some of those skin diseases are not. There's about 5 or 6 different skin diseases that can cause this, and identifying the correct diagnosis is very important to knowing what treatment to use and how aggressive to be in the treatment. What's the next area? Well, there are other things that can cause hair loss in women that don't seem to happen in men. For instance, some women can have severe vitamin D deficiency. A normal vitamin D is somewhere in the blood is somewhere between 21 and 50. That's normal. It can be higher without a problem. But when it gets down into the 15, 16% range, that all by itself can cause hair shedding. And if you get to them early enough in the process, you can reverse it. Chronic long-standing anemia, we see that very rarely in the United States, but severe chronic long-standing anemia can cause hair loss. So there are nutritional issues that can cause hair loss in women that we don't really see in men. There are endocrine problems. Endocrine is the hormone system. So women who have polycystic ovarian syndrome, diseases that cause high testosterone levels. These are things that can cause hair loss in women as well. Again, so when women are presenting with hair loss, you have to take the time with each and every one of them to do a thorough medical history, a careful physical exam, and design a series of tests, some blood tests, possibly even biopsy testing of the scalp, in order to make the correct diagnosis so that you can design a treatment plan that's going to correctly address the problem that they have. Much more difficult than male pattern loss.